Hey guys, welcome back to AMC. Today we have a pediatric style AMC recall question. So if you want to pause the video, have a look at the question, answer it, and then I'll get into it. So we have this picture of a kid with digital clubbing, okay? And all it's asking for is what is most commonly associated with this sign. So let's go through the answer options. A, SLE isn't associated with digital clubbing, okay? In the hands in SLE, you will see a rash, arthritis, and Raynaud's phenomenon. B, chronic Hep B infection. You wouldn't see digital clubbing in chronic Hep B in a kid. Remembering chronic Hep B in a kid will present quite mildly or potentially not even at all. You won't even see any symptoms, okay? So that doesn't necessarily lead to chronic liver failure, but chronic liver failure may present with digital clubbing. So important to note. Chronic asthma, this is incorrect. So you won't see digital clubbing in chronic asthma usually. So if you're seeing in a kid and they have asthma-like symptoms and they have digital clubbing, you've got to think of more of like a suppurative type picture of a lung disease. So you would be thinking about bronchiectasis or cystic fibrosis. D, ventricular septal defect, this is incorrect. So this is an acyanotic form of heart disease. So remembering that our pressures in the left side of our heart are higher than the right side. So you'll have a left or right shunt. So this won't cause digital clubbing. And that obviously leaves us with E, tetralogy of Fallot. So this is the correct answer. So this is where you can see digital clubbing with a long period of hypoxemia. So interesting to note, I looked it up just before this. Digital clubbing can occur not everyone knows why this happens, but there is the common theory of the megakaryocytal platelet theory, and that they bypass lung filtration. They release VEGF in the fingers, okay? And this can cause vascular and connective tissue proliferation. Remembering when we're examining someone, checking if they have clubbing, we ask them to make, like a love heart with their fingers, and we're checking to see if there's a gap in between the nail bed there. And if we can't, remembering that's called Shamroth's window, and if we can't see that, then we can kind of say that there is a picture of digital clubbing there. Remember tetralogy of Fallot, that we have a right ventricular outflow tract obstruction, usually due to pulmonary stenosis, an overriding aorta, right ventricular hypertrophy, and a ventricular septal defect. So this is among the most common type of cyanotic heart disease in children, even in Australia. So usually it will resolve in terms of the cyanosis, but if it doesn't, and there's a severe amount of pulmonary stenosis, then you may get a picture of a pediatric patient presenting with digital clubbing. So remember, this is over a long period of time. It's commonly associated with trisomy 21 and DeGeorge syndrome, which is important to note. In terms of diagnosing, definitive diagnosis can be made on a transthoracic echocardiogram. On an ECG, you'll see right axis deviation, so remembering that's negative in lead 1 and positive in AVF. And obviously definitive treatment for this is surgical correction of the VSD and also the right ventricular outflow tract obstruction. So thank you very much for listening. If you enjoyed the video, please give it a like, give us a follow, and let us know anything in the comments that you guys want. Thank you.